This is the cerebellum. It lies in the posterior cranial fossa on the back of the pons and medulla, from which it is separated by the fourth ventricle. It consists of two hemispheres and a median part called the vermis. This vermis bulges on the superior surface where it is called superior vermis, and also bulges into a deep hollow on the inferior surface where it is called the inferior vermis. The two hemispheres are partially separated anteriorly by an anterior notch which lodges the brain stem. And posteriorly by a posterior notch which lodges the falx cerebelli. This is the superior surface of the cerebellum. It shows multiple transverse fissures, the important of which are the fissura prima, horizontal fissure, and posterolateral fissure. This is the fissura prima, or primary fissure, which is V-shaped and cuts across the superior surface. Its apex lies at the junction of the anterior 2/3 with the posterior third and separates the anterior lobe from the middle lobe. This is the anterior lobe, and this big part is the middle lobe. However, the posterior lobe is a degenerated part on the inferior surface and is called the flocculonodular lobe and will be demonstrated soon. This is the horizontal fissure. It begins at the point of insertion of the middle peduncle and extends along the junction between the superior and inferior surfaces of the cerebellum to the posterior notch. The posterolateral fissure lies on the inferior surface and just behind the flocculonodular lobe. This is the inferior surface of the cerebellum. This is the inferior vermis. This is the flocculonodular lobe, which lies on the inferior surface of the cerebellum. It consists of the nodule, and the flocculus, together with the inferior medullary velum in between. This is the nodule, which is the most anterior part of the inferior vermis. The part of the inferior vermis just behind the nodule is called the uvula and is related on each side to a circumscribed mass called the tonsil. This is the tonsil. It lies on a bed formed by the inferior medullary velum. Thus, to display the inferior medullary velum, one has to remove the tonsil. Note that The inferior medullary velum stretches from the nodule medially to the flocculus laterally. This is a sagittal section in the cerebellar hemisphere. It shows the following features. These are the fissures which separate the folia. In the core of each folium extends a branch of white matter, thus giving the section a branched appearance called arbor vitae. This is the superior vermis in median section. Its most anterior part is called the lingula and rests upon the superior medullary velum just below the inferior colliculus. This is the inferior vermis in median section. This space is the fourth ventricle. This is its roof related to the cerebellum. And this is its floor formed by the pons and open medulla. The details of its description are coming soon. This is a horizontal section in the cerebellar hemisphere to show the dentate nucleus. It is called dentate because its surface has dentations like teeth. It gives rise to most fibers of the superior cerebellar peduncle. This is another horizontal section in the cerebellum which is stained to show the dentate nucleus. The dentations are clearly seen.